A new survey by the State Department of Health revealed that 82% of respondents noted a mental health condition in the past 6 months. This includes anxiety, depression, loneliness, to panic attacks. So what can you do to overcome this and take care of yourself? Joining us this morning once again is Kathleen Rose Merriam, a mental health expert from the Department of Health. Good morning, Kathleen. How are you doing?
Good morning. Good. Thank you for having me.
Now, Kathleen, first off, what's the biggest thing that caught your attention from this survey?
Well, I think the best thing is that this actually validates what we know in the field. We know that mental health matters, and mental health is like physical health, that it's definitely the stress that's going on with COVID-19 is affecting people's mental health. So though there were certain populations of people that are at higher risk, that really everybody's mental health is being affected, and it's time to pay attention to it. And each individual needs to look at one's mental health and how the daily stress of the circumstances in one's life is affecting our health, and that we need to pay attention to it. We need to address it and do something about it now.
So if someone is experiencing anxiety, depression, stress, or another mental health condition, what should they do?
Well, the first thing is really acknowledge it, that it's important to identify some of the symptoms that people are experiencing. So whether it's panic attacks or it's difficult breathing, sometimes people are having a hard time. They see some physical symptoms. People start feeling depressed. People start isolating even more. Of course, isolation is part of what we're supposed to do. But even because we're supposed to physically distance, it doesn't mean we should socially distance. So it's important to keep connections with other human beings. It's important to stay connected with family and friends. And so the first thing to do is really acknowledge your feelings and try to connect with another person, to talk to somebody about what's going on with you. That would be the first thing, is to really share your feelings. Sometimes people stuff them or hide them or don't pay attention to them, and then they can get worse.
And you talk about change is never easy and taking that first step and acknowledging and seeking help. The Department of Health actually has a hotline as well as a number you can text to receive help?
Yes, so the Behavioral Health Administration with the Adult Mental Health Division, of course, has a hotline that we really want to promote today. We found out from the study that not too many people know about that. And so it's the Hawaii Cares line, and it's that 1-800-753-6979. Now that's a coordinated entry system. So no matter what you're facing, you can call that line. And we've actually kind of ramped it up because we've added some additional resources. So there's now a Kumakani warm line added to that, so that evenings and weekends we have additional resources. So if you call that number and you say, I want some COVID counseling, then they're going to patch you into resources on your actual island that you live on. So we're really trying to beef up that line so that you have some help. So please call that line for whatever you need. So we want to get that line out. That's a line I would put on your refrigerator, in your car, at work, and pass that on, because there is somebody on the other end that can help you.
And Kathleen, real quickly, what's your final message? Because I know you talked about hope and a brighter future.
Yeah, I think that hope, if people lose hope, then that's the real problem. We need to know that things are going to get better. Your family and friends, we need to pass on that there is hope, that every day can get a little better, that this is going to end some of the struggles that people have. I know that every day can be very difficult, but we have to be together in this. The final message is that mental health matters. And so while you're paying attention to, job and children and people you're taking care of, your own mental health matters. And so try to do things daily that help the bigger picture in your life. So whether it's taking time to meditate, taking time for yourself to get some exercise, eating better, sleeping better, all those things are going to help us take care of our mental health. And definitely seek some help. Reach out to that 1-800 number. Reach out to people that maybe you haven't spoken to. Stay connected. Be connected to somebody so that you're not in this alone.
Very well said, Kathleen, and thank you so much for once again talking about this very sensitive but much needed topic to be talked about. And thanks for coming on this morning.
Thank you so much.
All right, coming up next.